Well, in case you're keeping track, it has been 14 days since hundreds of thousands of people first started packing Lollapalooza.
And at this point, it does not appear that the popular festival was a COVID-19 super spreader event. WGN's Rob Sneed is live in Grant Park with details on the numbers just out. Rob?
Yeah, good afternoon to you both. Health officials say that they did expect to see some cases with the number of people that actually attended that event. We're talking about 350,000 people attended, but only less than 250 people actually tested positive. Chicago health officials on Thursday reported 203 cases of COVID-19 connected to Lollapalooza, none of them yet linked to any hospitalizations or deaths. Officials say they anticipated this, and it suggests large gatherings won't be an issue moving forward.
So we continue to absolutely recommend that all festival and large event organizers require all attendees to be fully vaccinated against COVID or have a negative COVID test. We also are continuing to obviously recommend wearing the mask indoors right now, regardless of vaccination status, not forever, but while we get through this Delta surge.
The four-day music festival started 2 weeks ago. It drew about 385,000 people to Grant Park. Critics questioned holding the event during the pandemic, but officials felt it was safe enough to do so.
While people can carry the virus if they're vaccinated, if we have a group of vaccinated individuals, while they may carry it, they will not get infected with the virus.
Dr. Kathleen Mullane is the co-chair of the Chicago Medical Society's COVID task force. She helped come up with the rules to keep folks safe at Lollapalooza.
We sat down and looked at, first of all, what was the incidence of COVID in patients who were, or subjects, people who were vaccinated. And certainly back in February, when we were looking at this, the incidence of people who were getting COVID from after a vaccination was much lower than it is with Delta. And we actually made our recommendations initially based on that.
Of the 203 COVID cases tracked to the event, 58 are Chicago residents, 7 are from out of state. Of those vaccinated, 4 out of 10,000 tested positive for COVID. Of those unvaccinated, 16 out of 10,000 tested positive. And of the 385,000 people, 90% of those were vaccinated. As it stands right now in the city as a whole, today there are 369 confirmed COVID cases. While Dr. Arwady is saying Lollapalooza was not a super spreader event, Dr. Mullane isn't quick to agree.
Going forward, can we guarantee that no, this event was contained and we didn't have a super spreader event? I don't think we can say that yet. Time will tell, but it certainly looks good that the precautions that were taken in people being involved in the festival, that it worked.
And health officials also say on average 11,000 people in the city take COVID tests per day. Reporting live at Grant Park, Rob Sneed, WGN News.